Good morning, everyone, and welcome, and thank you for joining us today for our donor briefing on COVID-19 fund. I'd like to start by our time together by sharing a quote from Fred Rogers. Yes, that's Mr. Rogers. For me, the quote speaks to each of you on this call today. And I know some of you are still joining us, and we welcome each and every one of you. So Mr. Rogers said, when I was a boy and I would see scary things in the news, my mother would say to me, look for the helpers. You will always find people who are helping. Each of you are our generous community helpers. We couldn't do the work that we are doing without you. That's one of the reasons we thought it was important to communicate in this new way with you. I look forward when we can have our normal donor briefings and in person, but in the meantime, this is what we have and this is the way we'll communicate. Hopefully you've been getting our emails. We're trying this new form of communication today, so please be patient with us. We're confident our technology will work, but sometimes there are glitches. We welcome your feedback. I'd like to give a special shout out to Carmen Burgos, who is behind the scenes, and she is the mastermind behind this technology today. So we look forward to your feedback, your continued participation, and thank you for being with us today. All right, a few housekeeping items. All right, thanks, Carmen. All right, so all participants except for myself, Will, and Christina are muted. If you are having any difficulties, please contact us on the chat box, which you have on the lower part of your screen for most of you, but it says chat, and ask your question there, and we have someone monitoring that chat box. And then if you have a question, we're going to field questions at the after Christina and Will speak. Please ask your question in the Q&A box. All right. All right, so we thought we'd start with a little participation, and we have a polling question to start our time together. So click all that apply. How are you spending your days? And it's a multiple choice question. All right, so it looks like the majority of individuals are working remotely, and a good percentage are exercising more, and go down from there. So that's great. Work and exercise.
I would just add cooking or baking at all, less in record amounts.
Yes. Yes.
My 2-year-old granddaughter, who is here, who's living with her husband for the last 3.5 weeks, parents, my daughter, my son-in-law, is gotten totally cooking. So he, every time we ask her what she wants to do, she wants to cook.
Oh,
so,
that's precious. That's great. And home projects, I know for one, I've cleaned a few closets, and I'm sure other people on the call have done the same.
Not me.
Thanks, Carmen. All right, I will now turn the program over to Will Ginsberg, our CEO.
Thank you, Dottie. And Good morning, everybody. It's a delight to not be with you, but to somewhere how you're out there. So I wish together, as Dottie said. I looked at the list of who we acted on this call, this Zoom call, and lots of friends. So I want to say to all of you that I hope you're well. I hope your loved ones are well. You're staying safe, and first and foremost, a lot to do in this world we're in. First is to get through it. So you have my best wishes for continued good health for yourselves and for the people you care about. And I thank you for your interest, and I thank you for your support, not only about COVID-19, but in so many ways for the foundation and the work we do over many, many years in many cases. From the foundation standpoint, we certainly view this, maybe it's obvious, but we certainly view what's going on in our community and broader society today as a crisis. It is, and I think it's a crisis like no. That doesn't mean in the end it will cause more pain or more damage or be deeper or longer than other crises we've lived through. We don't know that. I think this is fundamental, like no, because of the way it's separated us as people, and because we don't know, because it is so uncertain. What of impact, health impact, how deep it go, how will it change the way we live? These are big questions, and we know the answer. So I think this, whether from the perspective of uncertainty, if nothing else, it's one of the reasons why a major priority of the foundations is to seek as much input as we can. And Christine is going to talk about been doing that with the nonprofits in our community. It's why calls like this are so important to understand who all are seeing, hearing, more importance of what's going on in our community. We really want to, because we are learning as we do know the impact of of COVID-19 is pervasive. It is affecting the whole nonprofit sector. It is affecting the whole for-profit sector. It is throwing off people's and into unemployment. It has brought the economy to a halt with all the impact that has. And we know we are trying to collect local data on this, or Connecticut data on this. We know in terms of national data, and the front page of today's New York Times, that COVID-19 is not only causing impact across the society, but it is negative impact, particularly focused in vulnerable populations, with minorities, the poor. So in many ways, COVID-19 is already, and we anticipate it will continue to exacerbate challenges that our society has, and the need for us to come together to meet those challenges. So that's an important part of it. I think the community response has been dramatic, and certainly from the foundation standpoint, our approach to this has been, we don't know everything. We don't even necessarily know enough, but what we know is we need to act and act now. And we know there's huge pain out there, and that's what we've done. So over the last 20 days, we really turned our work completely upside down. We focused almost entirely on COVID-19 and related impacts. We are certainly talking about all the things that were in our 2020 work plan as well, and when we can start doing those again. But at the moment, we're of course working remotely. The office has been closed March 13th, and we have really focused entirely on COVID-19. I'm very proud of the staff for the way in which our folks have responded. Working in a different way, working on different things, and I'm deeply proud that the foundation staff has responded to this as the crisis that it is. Our board as well, I think Kalila Brown-Dean, who is our board chair, is on this. Kalila was on the list. And we had a board meeting, remote board meeting on March 19th, where we took a series of steps, extraordinary steps to respond to this, which I'll be describing as we go forward, and Christina will too. And we've obviously stayed in touch with Kalila and the other leaders on the board, and the board is, and has been all in terms of doing everything differently to help the community meet these challenges. So let me talk a little specifically about what we're doing and with the resources that we have. We have both, our response has both involved how and when we allocate monies that were already in the budget, as well as raising new money in the context of the COVID-19 fund, which you all have contributed to, and we'll talk about that specifically, and also new monies by reaching into the foundation's endowments, and I'll talk about that too. So first, with the monies that were already in the budget for 2020, we've been accelerating and repurposing those dollars, and I'll go through this quickly. But so March 27th, a week and a half ago, we accelerated multi-year general operating support grants that would have been in the normal course paid in the fourth quarter of 2020. Those went out the door. That was about approximately $1 million of multi-year general operating support grants that had been approved in 2019, a few of them in 2018, so they were in the second or third year. As I said, in the normal course, we would have gotten reports, we would have reviewed those reports, and we would have processed those grants in the fourth quarter. Those went out, that $1 million went out the door March 27th. We also have multi-year program and project grants that we've offered to repurpose so that our grantees can use those for general operating purposes to meet COVID-19. And those conversations are going on now. That's another $400,000 or so. We have lots of designated grants at the foundation. These are funds that exist to benefit a specific organization, or in many cases, several specific organizations. We pay those out over the course of the year. We are in process now of accelerating our second quarter. We had first quarter designated grant payments before all this began. We're in the process now of accelerating our second quarter designated grants. Those will go out very soon. That's about another $1 million. And we are looking at can accelerate and when it makes sense to accelerate our third and fourth quarter designated grant payments, which is another $2 million plus. In addition, of course, so those are all monies that were already in the budget. We have new grants, of course, that we have been planning to make this year. We got applications at the end of February. Our schedule had us awarding those grants at the July board meeting. We're accelerating that as well. And we will be scheduling a special board meeting on or about the 1st of May, as close as we can get for scheduling purposes to the 1st of May, to decide on and award those grants and get those out the door as well. That's another $2 million plus potentially as well. That's the number that's in the budget. So if you add all that up, that comes to $6.5 to $7 million of monies that we are moving out the door on repurposing and accelerating over the next well, most of that over the next month, and some a little bit beyond that. So that's a substantial amount of dollars going out into the community. In terms of new money, we have established, obviously, the COVID-19 fund, and we're going to drill deep into that. It's a partnership with United Way of Greater New Haven, and we are grateful to our colleagues at United Way for joining us in this. We felt very strongly, and I think United Way did, I'm not going to speak for them, that the right way to approach this nation was not have multiple that the nonprofits would have to deal with, donors have to deal with, but to one combined thing, one in the community. We can talk about those too, but that the United Way and the foundation should be together on this. So we are doing our grant making together, and Christina is going to talk in detail about that. We are raising a dollar separately, but in regular communication. Dottie's talking to her counterparts at United Way on a regular basis. We have a joint committee of 6 volunteers, 3 of which are foundation board members, and three of whom are foundation board members, and 3 of whom are board or former board members of United Way, chaired by Kalila, who I mentioned before. The committee has met twice. They awarded $600 last Wednesday, that went out on Friday, and meet again this about a second, which week. We have raised about over $1.2 million from donors for donor monies for the COVID-19 fund. Again, thanks to many of you. Many of the lead donors for the fund are on this call. Found in approximately $500 of our own money. Some of it comes from reallocating our budget for this year and put to COVID-19 grant making, and some of it comes from a decision which we do very infrequently and very sparingly, which is to do what is technically called a special appropriation, which you might call invading the corpus of some of our endowments. These are particularly health preference funds and funds that were set up by donors over time to benefit the community's health and in some cases to respond to health emergencies. So we do have those funds. We do have authority to go in under extraordinary circumstances. It requires a supermajority vote of our board to do that. And we did take that vote on March 19th with respect to 4 specific funds that are health preference funds. So that's going to generate about $375,000 out of that $500,000. So the COVID-19 fund today, dollars going in has been a little over 1.7 million, about 1.7, maybe a little more, $1 million, and $600,000 has been committed. And there is another round of grant making to do next week. I'll just mention a couple of other things, if I may, and then I'm going to turn this over to Christina, and I'm eager to hear from you all. One is we are doing a special newsletter mailing over the next several days, talking about what we're doing, but talking also about what we've learned from the nonprofits and telling some stories about how nonprofits are responding. So in addition to we had our quarter newsletter in process when all this started. So you may have gotten that. It doesn't talk about COVID-19. So we're doing a special mailing to our mailing list about COVID-19, the impacts and the response. As I said, who knows what this is going to look like as it unfolds. From the foundation standpoint, we are proceeding on the assumption that this is going to, these impacts are going to be deep and long. I think that we will need, that $1.7 million isn't going to be sufficient to cover what we are going to need to do and what our community is going to need us to do. So there'll be, this I think will continue beyond this initial phase of COVID-19 fundraising and distributions. We are focusing initially on frontline, and Christina will talk more about this, on the front lines of this fight, the healthcare institutions and healthcare services and basic needs for the most vulnerable. But the impacts on the non sector are much more than that. The last thing I'll say is that we spent, it seems like a long time ago now, but we spent 2019 producing a new strategic plan at the Community Foundation, and many of you have heard me talk about this not only over the last year, but longer than that, focusing on opportunity, focusing on how the community needs to come together to grow and create opportunity and build on our assets, and how we need to do it in a way that is inclusive and reaches the whole community across the socioeconomic spectrum. That feels in some ways like a long time ago, but those issues, our view is, my view is, are as important, more important than ever. Coming out of this reform, and whenever that happens, the need to grow and create opportunity and recovery and get the economy going again is going to be at the top of the list, and the need to do so in ways that are inclusive, as I said before, because this crisis is exacerbating all the racial and socioeconomic divisions in our community is going to be more important than ever. So far from walking away from or putting on the shelf our longer term plans, we see them as more important than ever. And as we begin to see the light at the end of this COVID-19 tunnel, you'll hear more about that from the Community Foundation. So I will stop there and ask my friend and colleague Christina to pick it up.
Thank you, Will, and thank you all for your generosity and your interest in helping and learning with us as this crisis evolves. This crisis is creating community needs and demands on local philanthropy unlike we've seen before, or at least unlike I've seen before in my time here. On a good day, the needs outpace the resources, and these have not been good days. This crisis is exacerbating that, that disparity. I'm actually going to talk to you about some of what we're learning and hearing from the nonprofits about the needs and the challenges in the community, which I hope you're interested in hearing. And then I could talk to you more broadly about the grant-making process for the COVID-19 fund. As Will said, we are initially focused on learning and understanding what's happening on the front lines with basic needs and healthcare providers who are working with those most severely and disproportionately impacted with this crisis as it evolves. But generally speaking, there have been devastating revenue losses for nonprofits due to closures of organizations and canceled fundraising events across the entire sector for all sizes and all types of organizations. So it's not just a basic needs and healthcare issue. I'm going to run through some of what we're learning and hearing, and I look forward to hearing from you all about some of the things that you're learning and hearing through your connections to the organizations you care about. So I'll start by talking a little bit about healthcare and mental health care providers. Healthcare providers have had to endure significant expenses related to the transition to telemedicine services. Our understanding is that those expenses are going to be reimbursable by other sources through government spending, the federal government and the state government, but that money has yet to flow through, and those expenses are pretty significant in terms of infrastructure and laptops and technology. But organizations have made that transition really well. Places like Clifford Beers, Fairhaven Community Health Center, Cornell Scott Hill Health Center, BH Care have all stood up their telemed services fairly quickly and efficiently, despite the expense and the technical challenges behind that. But the transition to telemed services has resulted in the loss of about more than 60% of clients are not making their appointments or signing up to use telemed services. That certainly impacts not just the revenue for these organizations, some of which are reporting revenue losses in the six-figure range per month, and anticipating that over the next few months, but also the concern about the clients or patients who are not taking advantage of those services and their well-being in the community and looking for ways to check in on them. Some healthcare providers have started delivering meals and groceries and gift cards to some of their clients in the community as a way to check in on people's well-being and reinforce the importance for social distancing. Some of the populations these organizations work with in the community are at risk for not understanding or maybe not following or taking serious social distancing, therefore presenting a risk not only for themselves, but for the greater public. So these healthcare organizations are looking at innovative ways while remaining the social distancing guidelines to check in on their clients and their well-being and to reinforce what they should be doing. There are healthcare providers who are especially concerned about their own preparedness to deal with staffing levels, assuming that their staff are eventually going to be impacted by the crisis and become ill. The organizations serving the elderly, places like Mary Wade Home and Visiting Nurses of South Central Connecticut, are concerned about their patients' well-being as well as their staff. Some of them are implementing some innovative ideas in supporting their staff. For example, Mary Wade is providing transportation, private transportation for their staff to keep them off public transportation where there's a greater risk of being exposed to COVID-19, therefore exposing the patient population to COVID-19. I think there's an overall concern among mental health experts about the impact of social isolation, not just on people who were already vulnerable because of health or mental health conditions, but for all of us, and particularly children who are now isolated from their friends and families and play dates and having to operate in this whole new social construct. I'm going to talk a little bit now about some of the basic needs themes that have emerged and that we're trying to address. In terms of shelters, which maybe some of you are reading about some of the controversy around this in the news, they're emptying out shelters and moving people to hotels and trying to move the homeless population into hotels because being in a congregate setting really presents a high risk for transmitting COVID-19. And in the region, most of the homeless shelters have been emptied out and have moved folks into hotels, which was quite an undertaking. I think there's at least one more shelter that is dealing with that transition now. That presents issues around food delivery and meals because now the shelters need to continue to provide meals and food, actually more meals and food to these individuals who are now living in hotels. So that's the issue around housing and shelter, part of the issue. In terms of food and food insecurity, there is a projection that there'll be a drastic increase in the next 12 weeks on the demand for food. There are many people who are now unemployed or without income or reduced income who need access to food, who aren't accustomed to accessing food or help in that way and don't know how to do that. There are many of the food pantries, particularly the smaller food pantries, that have closed down because they're mostly run by volunteers, particularly older volunteers. And at the governor's directives, they have closed some of those places. There are new systems being put up in terms of food distribution. Organizations like Downtown Evening Soup Kitchen and Loaves and Fishes are taking the lead on that in Greater New Haven. There's also the same issue that we saw with shelters is present with food and some of the pantries and soup kitchens, in that it's very dangerous to have people in congregate settings. So trying to figure out how to set up new systems to get people food. Also, as I'm sure many of you have heard about, most of the public school districts, if not all the public school districts, have set up systems to get foods to meals to families. Most children are usually fed in school all day and now are not in school. So the school systems have been putting up systems to deal with that and distribute food. And as they're distributing food, they're also able to distribute other items as well, like diapers. And diaper distribution has also been a huge thing impacted by the COVID crisis. There is a significant increase in demand for diapers, as well as other things that children might usually get in a daycare setting or a school setting. And the Diaper Bank is an example of an organization really doing leading work on figuring out how to distribute diapers and other necessities in a different way. There are other organizations in terms of basic needs. It's not just the usual organizations we're looking at that are known for delivering basic needs. There are other organizations who have relationships with families in the community, particularly youth-serving organizations that are revisiting their business and their role and figuring out how they can support the families they work with in helping meet some of their needs during this difficult time. While education was not an initial priority for the COVID fund grant making, we are concerned about this area. As Will mentioned, this crisis is going to exacerbate already existing inequities, particularly in the education field. And there are significant issues around access to internet services and to technology and to laptops and Chromebooks to help children participate in the distance learning that's being implemented by the public school districts. There's a lot of efforts also underway. The good news is there's a lot of efforts underway to get these children who don't have access to internet or Chromebooks access. And there have been some large philanthropic gifts and efforts around those issues across the state and as well as locally. I'm going to talk now about a few of the emerging concerns that we're starting to talk about as we think about the COVID-19 fund and the foundation's response. And that's the need to pay more attention to the undocumented population. This is a group of people who are at significant risk for not accessing health services. There's issues around trust between the undocumented population and the health service delivery system. We are finding ways to work with the organizations who are embedded in that community and trusted by that community to ensure those individuals are getting what they need and accessing services they need. There's also a concern that the undocumented population is not going to be eligible for some of the public benefits that are coming out of the COVID-19 government response, and it's something we're keeping an eye on. We're also becoming concerned about personal safety as an issue as we talk to some of our nonprofit providers and leaders. This is in relation to the projected increase and the already increase in domestic violence, as well as the concern about children and mandated reporting. And, children are home now and they're not being seen as often by mandated providers, whether it's mental health providers, healthcare providers, the school, what have you, and concern about the safety of children, some of whom are home in families where parents are essential workers and are still going to work, and some young children are at home alone or home being watched by older siblings. Also, something we started to talk about this week is the implications of the Families First Coronavirus Response Act on nonprofits and their ability to continue to serve individuals in this crisis. There are some mandates in that could severely impact nonprofit capacity in terms of giving staff access to emergency leave to deal with their families who could be sick from COVID-19, or because families are now home because children are out of school and daycare is closed, so it's hindering the ability of some parents to work remotely or otherwise. There's also other organizational concerns around nonprofits more broadly in terms of unemployment and those that are self-insured and their ability to keep up with unemployment benefits. We're also looking at a group of youth-serving organizations, as I mentioned before, and how they're responding to this crisis and how they're working with families and have important relationships with families that could help us learn more about the challenges that some of these individuals are facing. So I think that's a quick rundown of some of the things that we are learning and hearing. As Will said, this is changing and evolving every day. The COVID-19 Community Fund made its first round of grants last week. That was announced on Friday. And we're anticipating making a second round of grants on April 17th. And we are working on proactively reaching out to organizations that we know, both the Foundation and the United Way know, working on the front lines of this crisis to understand the needs and figure out how we could respond quickly to address those needs. And as Will said, we're working with a small committee appointed by both the Foundation and the United Way. And that work is continuing. Those grants will be distributed on a rolling basis. And I certainly welcome suggestions from those of you on the line. If you want to reach out to me offline and let me know about organizations or groups of people you're especially concerned about, we are open to hearing that and open to that learning. So I'll close there with another thank you to you all for your generosity and in helping us address this crisis. And I look forward to hearing some of your questions and learning from what you're all hearing. So thank you.
Thanks, Christina. All right, so I wanted to reiterate, there's no questions in the queue right now. On your screen, if you move your mouse, there's a little box that says Q&A, and you could type in a question and then press enter on your keyboard, and then I will be able to see your question. Will, you want
Dottie? Yeah, just one other point I would make, I didn't say before. We obviously emphasized, for good reason, the partnership with United Way around the COVID-19 fund. We are also, in different ways, working and in regular communication with the city of New Haven, with the state of Connecticut, and I've been very involved with the state, at the governor's behest, is creating a new statewide private philanthropy called 4-CT, which I can talk about with Yale University and the fund they announced, with the Jewish Federation and the work that the Jewish Federation and the Jewish Foundation are doing around COVID-19, with our own affiliate in the Lower Naugatuck Valley, the Valley Community Foundation, with the Brantford and Guilford Foundation. So there's a lot going on with other funders as well, and other entities that are close to all this. Happy to say more about any of those if people are interested.
Thanks, Will. Okay, we do have a couple questions. One from Sam Chauncey. I'm encouraging my friends to buy gift cards at local restaurants that are doing takeout. I then want to get the gift cards who need food. Is there a place these gift cards can be deposited and then distributed? Christina, do you know of an organization?
I do know that Clifford Beers is giving out gift cards to their clients, and I think other organizations are as well. When we get off the call, I can get a short list of organizations, but for sure I know Clifford Beers is one of the organizations doing that because we gave them a grant to help support some of that work.
And I also know that, which is a slightly different, Sam, than your question, but related, both in my conversations with Yale and in my conversations with the city, that they are talking about, I don't know the status of it, but organizing an effort to raise contributions that would go, maybe in the form of gift cards or in other ways, go to the local restaurants and food service providers who would in turn keep their staff, their kitchen staff on board and prepare and deliver food to first responders and to the home, going back to Christina's comments about homeless individuals and families living in hotels and motels, deliver food to them as well. So I think Mayor Ellicker's office and the Office of New Haven Affairs at Yale are standing up some kind of an effort to do that.
I would also add to my answer to that question is that the statewide group of United Ways has a way of getting financial assistance directly into the hands of individuals. And they are giving out, I think they're like virtual MasterCards. So through their statewide fundraising efforts, they are able to get money onto these virtual cards so people can use them for their basic needs. The other need which Will just reminded me of that I wanted to mention, is the need to support healthcare workers. We know over the next few weeks that this crisis is going to hit hospitals pretty hard. And we are looking at ways to support childcare for healthcare workers, which some organizations are working on, as well as other types of respite services targeted to support the individuals working in the hospitals and the healthcare settings.
Thank you. Excuse me. So there's another question. Hi, Denny. You're always a step ahead. So Denny Wakerly was asking about the Great Give, and I will talk about that in a few minutes, but I'll talk about it now. So yes, we talked about the Great Give happening early in May 5th and 6th. We talked about it as a senior staff, whether we should go ahead with it, and the decision was yes. now more than ever. And we modified it a little. Our slogan is coming together while we're apart. And we thought it was extremely important to do the great give because there are many nonprofits that aren't going to be funded, certainly through the COVID-19 fund, and they've had to cancel events. And one area certainly is the arts. They don't have income from performances. So yes, and the pre-sale for donor advised funds, we're opening, you'll be receiving an email this afternoon, and it's open right now for early giving. So you'll be hearing more about that. Do you want to add anything, Christina or Will, to that?
Only that I think the give is, it will feel different. It will be different this year. It will feel different this year. It'll be messaged differently this year because circumstances are very different. But as is obvious from everything we've said and everything you already know, the social sector needs it desperately. So our decision was we needed to go forward with this. I think it's very important. So I hope the community will respond to that as it has in past years as well.
Great. Do you want to add anything, Christina? No. Okay. So a question, do you know of any volunteering work within these organizations that we can help with remotely?
Yes. I think as our follow-up email to this phone call, we could send that information out. There is a group organizing remote volunteer opportunities. I believe if you go to GNH community, you could find that group and find those opportunities. There is also on United Way's website, they are tracking specific needs around volunteers and matching volunteers. I don't think that's necessarily remote volunteers. That may be some in-person volunteering that is needed. But yes, there are opportunities and we could share those resources with you after the call.
Can you just tell people, Christina, how to get to GNH community?
I would just Google GNH community, all one word. And if you're not already a member, you can become a member and you can connect to that.
This is a social media site of the Community Foundation.
And actually we have someone in the chat box who's confirming what I just said, that I know Lee Cruz had posted this on these online remote volunteer opportunities on GNH community, which you could also link to from our website as well. Great.
All right. Another question. Is there anyone working to clients trying to access telehealth services, the technology support you mentioned in the realm of education?
I'm not sure I understand the question. So there's helping individuals in their homes actually use the technology and access telemed services. I think that's a really good question, and that could certainly be an opportunity for a remote volunteer. I'm fairly certain that some of the reasons people are not accessing telemed services is either because they just don't have computers or the technology. You need to have a phone on your camera or your laptop. I mean, you need to have a camera on your phone or your laptop. But I'm sure individuals need help with that. And I don't know of anyone other than the organizations who are trying to troubleshoot that with their clients.
And then in the area of education, I think the thought was technology and education too.
Same thing. I think it seems like there's more going on in that realm, and a lot of efforts that maybe are happening in isolation and are not coordinated. At the state level, there's some work. CT4 wants to focus on that. We know that they've put laptops, with the help of the Dalio Foundation, they've put laptops into the hands of all the high school students. I think what we're worried about is laptops and technology and access for the middle school and elementary school age students. And I'm not aware of specifically technical assistance in the homes, but for example, I know Comcast is advertising that they're providing free Wi-Fi and technical services to help to help individuals in their homes access those services. I've heard about buses that have Wi-Fi capability that are going to be available or maybe are available in some neighborhoods to help people access some of that technology. That is one area that is evolving and changing daily.
Thanks, Christina. And Will, do you want to talk about the, we had a recent donor that wanted us to purchase Chromebooks for the.
Yeah, yes, I can mention that. I would say, I mentioned in passing that we had a call, a group of us, which is a regular meeting, and of course by Zoom last week with the superintendent and her top team at New Haven Public Schools. It's very clear from conversations with them that their top priority for private philanthropy is this issue of getting equipment in the hands of these families, and that there's a big gap between what people have and what people need. It was their estimates on how many more machines were needed, and the price of those machines was probably, a $3 million gap. And that didn't even get to the issue, which the question from Emily Fine was about, which is helping people use this. One would assume, and it's just an assumption, I hadn't really thought, it's a very good question. One would assume that there's a lot of overlap between those school families and the families that are the clients of Fairhaven Community Health and the Cornell Scott Hill Health Center, et cetera. So there's some overlap between the health needs and the education needs around using this equipment and serving those needs remotely. We did have a donor who came forward, actually came through the City Hall, was contacted last week by Mayor Elliker. Someone had contacted him, wanted to give, make a significant gift, a $50,000 gift to support the purchase of Chromebooks for New Haven Public School students. We were able to do that, take the gift, arrange for the purchase. Those have been ordered now, and they are going to be delivered directly to the school system. So that was all done within a period of 72 hours, and that was complete. That order was completed yesterday. So, but that's a very generous gift. $50,000. It bought 212 Chromebooks, I think. But in the context of what the school system is saying their needs are, it only deals with a small fraction of that need.
So Will, there's a question about, are we doing anything to assist affected local businesses? Would you like to speak a little bit about that?
Yes, and this is a question that a lot of people are asking, not only of the foundation in general. This is not the primary focus of the Community Foundation and the charitable dollars that are at our disposal and that you all have contributed so much to. I know the Chamber of Commerce is focusing on this, and we've been in regular contact with the Chamber leadership. I think their role primarily in the context of small businesses access the new money that's come through the federal program, this Paycheck Protection Program, which this administering, which has a third of $1 trillion, something like that, and that window opened last Friday, and other programs as well. So I think the Chamber sees their role as a technical, as an information role. City Hall is very focused on this as well. It's very focused on it too. Can't speak for the university and Yale Fund that they are raising this $5 million, but I know that in my early conversations with Yale, they were talking about not only the social sector but the small business sector, and of course Yale is a major landlord for small businesses in downtown New Haven. So there are efforts. We have some resources potentially available through the Community Foundation, through our mission investing side, which we are talking about how we can work with small businesses and entrepreneurs in that context. But our focus has been so far on the social sector. I think that the small business sector is being devastated by this. And frankly, I'm sure there are many things going on that I am not aware of. But I think I think our community needs a very robust, perhaps more robust than we've managed to stand up so far, effort to assist businesses.
Thanks, Will. All right, so I really appreciate this comment as opposed to a question, but I hope you will remind us each month for a while to renew our contribution to the COVID-19 fund. We will try not to be annoying, but as Will said earlier in his remarks, that the 1.7 million that's currently been raised or contributed from funds at, that already exist at the Community Foundation will not in any way put a dent in the magnitude of this problem. And we always are looking, because we're an endowed organization, at the long term, and then certainly in this case in the short term, and trying to balance both of those things. So we will certainly send communication out and offer you the opportunity to contribute again. So thank you for that. All right. So Will or Christina, do you want to add any other remarks? We have a few more. We have one other polling question, and we have a few more slides.
Well, yeah, I would add a couple of things. One, I'm seeing a question here from my friend Steve Ham about who to contact at the chamber. Steve, I would contact Garrett Sheehan, who's the CEO. Garrett's been there a couple of years and is focused on this, very effective. So it's Garrett Sheehan. He's the CEO at the chamber, and he's going overtime on all the stuff, as you might imagine. So I think that's the person to be in touch with. You know, if I can, Dottie, just another minute. I mean, one
Sure.
thing that we have that I didn't mention in my opening remarks, and is a whole nother subject related to that. As you might imagine, we're taking a hit, as is everyone who's in the investment markets on the investment side here too. And the endowment obviously isn't worth what it was worth a month ago at this time, or 2 months ago at this time. So we're watching that very closely from an impairment standpoint and a cash flow standpoint. We actually last night and this morning working on the March 31 numbers, which we are going to talk about in this mailing, this COVID-19 mailing that I mentioned in my remarks. The bottom line is, the endowment is down. I don't have a current number. I don't have the March 31 number yet. As of mid-March, we were down significantly, but ahead of the broader market, because obviously we have hedged assets and fixed income assets, and so we have our portfolio to take care that the market goes through steep ups and steep downs, but we are down significantly. And the decisions that we will make and our board will make about invading corpus and the kinds of things that I talked about already, we've already made a decision to do that once initially, as I said, will all be taken into account. So this is a balance, this is the balance that the foundation has to deal with every day between preserving the community's endowment in perpetuity for the long term and meeting current needs. In an environment like this, it becomes a more difficult balance to draw because values are down, and in that sense, the pressure to preserve is greater, but the needs are much greater too. So that's part of what this is all about too.
Thanks, Will. All right.
I would just add, Dottie, that I'm happy to hear from people about the things that you're concerned about, or particularly organizations that you're concerned about. As Will said, we don't know everything. And this is all happening and evolving very quickly, and we're doing our best to stay informed. But one way we stay informed is by hearing from you as well. So don't be shy about reaching out to me or someone else on staff you may have a relationship with.
Thanks, Christina. Yes, Christina will
Including me.
communicate regularly, and so any of us would be glad to answer your question or find the answer to your question, and then listen. We're doing a lot of listening. We don't have all the answers. All All right, Carmen, can we go to the next slide? All right, so we have another polling question. All right, within our community, which issue area or areas are the most important that you're concerned about right now? And you can put in multiple areas and submit, please. All right, no, Carmen, I don't see the results yet.
Eager to see them.
I know. I think Carmen can see them, but we can't see them yet.
Okay, how about now?
Nope.
Still can't, okay. I'm gonna share for the third time.
There you go.
Hey.
All right. So any thoughts on that, Will? Was it what you?
You know, I think it bears out at some level the judgment we made at the outset that to focus on healthcare and healthcare providers and basic needs providers. But, you know, looking at this list, I mean, everything and everybody is affected. The arts and culture sector is deeply threatened. Civic vitality has never been arguably more important. The economic toll here is huge, and economic success, as I said before. So it's hard, and these numbers reflect it. It's hard to say, you know, focus all this effort in one or two areas. And obviously that's, I think these results reflect that. On the other hand, you know, there's only so many dollars that are going to be made available, and there's only so many hours in the day. So this is very useful information, and I think it reflects the challenge that we all face, which is in this kind of environment, where to turn.
I think it also reflects the opportunity of what a community foundation represents in a community, because we're a broad-based funder, and we have over 900 funds that all have a particular, or a lot of them have a particular focus area. So like you said earlier, it is that balance.
Right. But it certainly bears out the focus on healthcare and basic needs too.
Definitely. All right, so earlier I mentioned briefly about the Great Give, May 5th and 6th. It's our 36-hour online giving event to support local nonprofits. And we are doing it this year. We're doing it a little differently. We're very excited about it, and we hope that you participate and give to your favorite local nonprofits. And our slogan is coming together while we're apart. And the donor advised fund pre-sale is opening this afternoon. You'll receive an email about it. All right, any closing
Again,
remarks?
for just gratitude. You know, so much caring in this community, so much commitment. You all, in front of that line, have been in so many cases for so many years. And when the going gets tough, which it certainly is, we are so appreciative of all the commitment and generosity you bring to this community. And we're here to be of assistance to you in terms of the learning and in terms of the giving in every way we can. So, let us know what you, let us know how we can help you. Let us know who we should be helping. This is the moment for all of us who care deeply to step forward, and we are so grateful to you moving forward.
I just want to add my thanks, and for those of you that celebrate Passover or Easter, I wish you a happy Passover, a happy Easter, and be well and stay healthy.
Yes, indeed.
Thank you so much. Oh, there's going to be a survey after this, an evaluation. So please take a minute to complete it. And we will be having another call on Monday, April 20th at 11 o'clock. And we hope you're able to join us. Thank you so much.
Thank you.